Hello everyone. Today I'm giving a critical appraisal on a research article on e-health. Before I get into my article, here's my motivation. As you can see, only last month, the Daily Mail newspaper in UK announced a £12 billion project. National program for IT was cancelled and scrapped. This was meant to be the world's biggest civil information technology program. Their initiative was to deliver a single central electronic care record to connect patients to 30,000 GP and 300 hospitals in the UK. E-health projects are ongoing in many other countries. However, even with much political involvement and dollars, successful e-health implementation has been variable. This motivates me to choose research article which talks about difficulties of implementing e-health initiatives. The article that I'm going to talk about is Why is it difficult to implement e-health initiatives? A qualitative study. This article is based on UK health system. It identifies the importance and experience of implementers. Implementers here are people who are directly involved in designing, planning, and implementing e-health system. The paper has two clear aims. Firstly, to listen to what implementers has to say on e-health system both in positive and negative ways. Secondly, to show that NPT, which stands for Normalization Process Theory, successfully provide a good framework to measure the various aspects in building an efficient e-health system. NPT will be discussed a little bit later. Overall, research focuses on social action approach to implementation. Before I get into detail, I'm going to explain the overall research design. Qualitative research was carried out using case methodology. Qualitative research investigates why and how, not just what, where, and when. It uses a small number of samples, but is used in a focused way. E-health systems are complex, and by investigating each case study in depth, conclusions can be appropriately driven by qualitative study. As a first step, 3 case studies were used in this research. 3 case studies were chosen to include a range of healthcare and variety of e-health initiatives across various locations. Semi-structured interviews were conducted with implementers of e-health initiatives. Thirdly, then, interview data was collected, analyzed, and coded using normalization process framework by independent researchers. Since interview data can be quite subjective, researchers want to make sure that their measurements were correct. Therefore, they brought initial interviews to record and compare data coding results against their initial results. This ensures validity of the data. Then finally, they assessed the result and drew conclusions based on their initial aims. Normalization process theory, which stands for NPT. NPT was mentioned a couple of times earlier in the presentation. What is it? How is it used? To start with the definition, NPT is sociological toolkit that can be used to understand the dynamics of implementing, embedding, and integrating some new technology in health industry. NPT has 4 collective action components. IW refers to the impact that a new technology has on interaction between health professionals and patients. Relational integration measures relation between different groups of professionals. SSW refers to the fit between new technology and existing skill sets. CI refers to the fit between new technology and overall organization goal, leadership, and resources. Those 4 action components were important to measure, which allows the researchers to normalize the qualitative research data. I'm going to look at strengths and weakness of the research in summary. The strengths of the research. The research paper had a clear 2 aim, which has already been mentioned at the start of presentation. Research design was appropriate as qualitative research enables researchers to gather an in-depth understanding of human behaviors. The recruitment strategy for aim of research was appropriate. Purposely, there was a recruitment of senior level of health staff, senior staff from bodies implementing e-health system, and also middle management staff as well. Researchers were independent, so there were no potential bias between participants and interviews. Analysis of data was rigorous by introducing a solid framework, NPT, and information was constantly validated by comparing the results from different researchers. Researchers were clearly aware of and state their limitation with ethics committee. They had a clear conclusion. Firstly, implementers were useful, valid, and should be used for further research to build e-health system. Secondly, NPT is useful structural frameworks which can be used to examine complex systems to determine whether they can be integrated and embedded in organization for e-health system. However, there are few weaknesses found in the research paper. Due to ethical issues, researchers weren't allowed to include any adult conversations, confidential documents, and observation, which can be very useful sources of information to examine their social behaviors. And also relatively small number of case studies. Due to resource constraints and low number of interviews, wider range of case study would have been useful. The authors only really state evidence for their finding and do not include arguments which can be against their conclusions. Overall, research was very valuable. Two important research areas to focus on have been identified. These are implementer's view on e-health system and MPT analysis methodology itself. Research found that implementers' perceived view on e-health system are vital for implementing and reassessing e-health system. MPT framework will provide a good model which will help managers, clinicians, and researchers to better understand and implement innovative, complex technology. By looking more at implementers' view, the better groundwork can be established for building e-health system which can be implemented and integrated. This is my finding from my article, and thanks for listening. Thank you.